Welcome, guys, to our exam review. I am recording it just so that you guys have it. What I would suggest to you is that you listen to the reviews, all of the ones that are being held. That's just a good way to do it. Let's see what else. My name is Professor Aloni. I teach community on Tuesdays, but some of you guys are my students and some aren't. What I'm going to ask you to do is to put your name and professor in the chat. I will copy and cut. If you're my student, just put your name because I know who you are. And what I did for tonight's review is I'm going to do a PowerPoint that covers the study guide. What I'll make sure to do is let you know that you guys are going to be tested on the study guide. It's pretty cumulative, but when we go through the review, I'll try to go through it piece by piece so it all makes sense to you. Are there any questions before we start? It'll be 50 questions, multiple choice, 5 math problems. What else can I tell you? What I would suggest, and I'll emphasize this again, is studying off your study guide. Okay, the professors write the exams, and with that, we write the study guide. So know that we are prepared and ready. So anyone who joined a little late, what I'd ask you to do is put your name and professor in the chat, and that way we have everybody recorded. My students, just put your name and I'll take care of that. All right, so we're going to get started so that we can make sure we are done. I'm going to share my screen with you, and we're going to take a look at this PowerPoint. Can everyone see it? Yeah, okay. So what I will tell you is this PowerPoint is not to be shared with students. And the reason for that is we don't have the authority to reproduce. So it's going to be on here. If you want to see it, just look at the recording and you'll be able to watch it. But let's enable editing, and we're going to do our studying. So when we first talk about community, when we first talk about community, the first thing we're going to look at is what are we evaluating in our community. Know that our public health is our health status of a defined population of individuals. It's going to be our health status is really what we look at. When we look at that, we're going to look at things like playgrounds, lights in the streets, drivers programs. How are we keeping our community safe? And what are we doing to help with that? So we want to really evaluate what do they know and what do they need to know. We have age-related concerns that we talked about last week in my class and probably last week in your guys' class. So we have infants. We're going to take a look at SIDS and abuse with infants, because remember, infants can't report. Then we have children. We're going to look at what environmental things we're going to look at on a playground or common areas. What's going to put a child at risk? Where's our priority? Where's our safety and recommendations? Think about those with the chronic illness. We're going to encourage them to have a medical home. Is everybody familiar with a medical home? Doesn't mean that their house is medical. What it means is all their files are kept together in one place, okay? So what that allows is, for the records not to get lost, for the follow through, chronic illness. Remember, we're going to be following up with them and making sure they stay with their appointments because the appointments get overwhelming. With our adolescents, I put a little picture here for everybody to remember. We're going to be worrying about our car safety. Seatbelts is a big one. We're going to evaluate with the parents. What are they doing in the home? When we look at tertiary, we're going to look at primary, secondary, and tertiary prevention as we have in class. And remember, with our tertiary, we're going to look and see how does this come into play when we're planning for children with a chronic condition. So we're going to make sure they get to those appointments because it may be difficult for parents to follow up with all that. So recommendations and assess interventions are the things working that the child is doing, those kind of things. We're going to review again with age. Another emphasis on our adolescents. And remember, we're going to look at violence. Sometimes in their relationships, they'll experience violence, drug abuse, alcohol abuse, importance of safety and seatbelts. Remember, what is our leading cause of morbidity and mortality? What is that in adolescence?
Anybody? The automobile accidents.
Yeah, accidents is going to be a big one. So we're going to make sure we're really intervening with that seatbelts and seatbelt safety, right? And when we look at our risk assessments, young children, our families talking to their kids about drugs and alcohol, what kind of prevention is that going to be if families are talking about drugs and alcohol to their young kids?
Primary.
Good. They're going to be doing it before they are exposed. Guns and safety is a big one. We're going to make sure we tell them how to store it, so it's going to be locked up. Gun control legislation we'll go over, and to make sure we know what are the rules in our states. And we emphasize that we don't mix alcohol or drugs with gun usage in the home, right? So here's a cute little picture, but we have our gun safety. We have our playgrounds. Remember what we look at playgrounds? What's going to be underneath the playgrounds? Is it going to be rocks, concrete?
There's not supposed to be.
Good. It'll be gravel, which is going to be able to protect the falls, right? And then we have our babies. Make sure we're telling them sleeping on the back for our SIDS and things like that. We take us into some ethical issues. You guys, we will all as a community will talk about ethics in the next couple of weeks. But during our patient rights, this is in chapter 2, ethical abuses relating to abuse and screening. So we're going to maximize for our older people that they take care of themselves, right? So we're going to help them manage their diseases. We're going to prevent complications, achieve highest possible quality of life with our older people. We have 2 different types of community nursing. We have community-based, which is going to be our ill families and individuals. And then we have our community-oriented, which is going to be the healthcare of not those that are ill, but to sort of make the risks lower. We'll look at individuals, we'll look at families, things like that. And we continue on to our preventions. This is something you will need to know. You will need to know examples. So we have primary is prevent, secondary is screen, and tertiary is treat. So an example of a primary prevention. Can somebody give me one?
Vaccinations.
Good. Vaccinations is going to be preventing our problems, right? And then we have our secondary screening. So it's an example of a screening.
Mammos. Colonoscopies.
Yep. Think outside the box a little bit when you get your blood pressure checked in an office. That's going to be a screening. We're going to have fasting blood sugars, right? For our screening for diabetics. So think outside the box a little bit on that. We also have our tertiary, and that's going to be our treating. And we're going to make sure, how does this come into play? This is the second time I'm emphasizing this. With chronic illness, you're going to follow up with those kids. You're going to make sure they're getting to those appointments, which they can miss. When it comes to smoking in children with chronic conditions, what are some things we're going to do? What kind of chronic condition are we going to worry about with our kids and smoking?
Asthma.
Good. And so with our asthma, what are we going to do for primary?
Teach the parents to not do it around their kids or to quit.
Well, they're already doing it, the parents. So what are we going to do for our kids?
Teach how to not engage with the allergens that might be causing it.
Okay, we're going to teach our kids no smoking, right? We're going to teach our kids no drugs. This is before it happens. And then tertiary, what kind of things are we going to do if you have an asthmatic in a smoker's house?
Smoking cessation.
Yeah, support groups. Yep, to quit smoking. Yep, for the parents. And now for the kids, what are we going to be treating them with? Our inhalers, right? Because they already have
medications for the asthma. Is that what you meant?
Yeah. Yep.
Oh, okay.
Exactly. Yep. Good. Good. So I want you guys to be thinking whenever you're reading a question or anything on your test, or primary, secondary, and tertiary, you really want to think about those 3 words: our preventing, our screening, and our treating. Okay. There will be some information on the test on Medicare versus Medicaid. What I want you to know is this: Medicare has the word care in it. It's going to be 65 and older, our baby boomers. And what's happening is they're getting older. So their life expectancies are extending as well. And we look at our Medicaid, where we're giving aid to those with low income levels and disabled or unable to work. We have two primary healthcare systems that we work with. We work with our primary care, which is like our private people, and then we have our public with Medicare and Medicaid. How do you think we compare to other countries with our healthcare? Are we cheaper or more expensive?
We're more expensive.
Yep. Our healthcare is way more expensive in the United States than it is across the board, okay? So that's where we are providing government assistance with our Medicare and our Medicaid. But remember, we have public, which is going to be that. And then we have our primary, which is going to be our private sector. We have our Affordable Care Act, which we know was helped to pass to have to Americans to access more healthcare. What did it do for us? We increased those who could afford it. We made things lower. And like I said, our healthcare costs are higher, but we really see our indicators of health are not any better, even though we're spending more money on our healthcare system. Okay, so worker salaries have not kept pace. Employees' contribution grew 55% in 2007. So think about that, how much you'd have to have a 55% raise in your income, which we all know that would never happen. Any questions about Medicare and Medicaid and the Affordable Care Act? Because that is something I want you guys to know for this exam. All right, we then take a look at our public health policies and what they do. They're going to create our standards. They're going to decrease mortality related to chronic diseases. Leading cause of mortality is going to be our chronic diseases. Okay, increase in number of older adults. We talked about that baby boomers. There's a lot increasing our population. And so we have a challenge there because of that. Population of the world is increasing due to increased fertility rates as well and decreased mortality. People are living longer and we're having more babies. So we're going to have that. Okay. We have things like vaccines, like screenings, like medicines. That's making it better and easier for people to live. Any questions on that? We really want to know what's happening with our public health system. So our goal as public health nurses is going to be prevent of our disease and disability, or to minimize that. We rely on several different institutions. We have the World Health Organization, and they're going to guide us on public global health. On our CDC, that's going to protect the public through research. And then we have our Institute of Medicine, which is going to be our development of policy that impacts overall public health. So one thing I'd like you to know is these three different organizations and what they really focus on, okay? The World Health Organization, we kind of know what that is. That's going to be our global, taking care of everybody. But they all relate to public health in some way or another. And when we're looking at public health and what we're going to make sure that we do, we're going to have our advocacy and we're going to have our social justice. Two definitions here. Advocacy is going to be our actions taken on behalf of another. Like a nurse may advocate for vulnerable populations by working to help improve public health services for them. And then we have our social justice, which is going to be justice with respect to the treatment of more advantage versus less advantage. And we have to be very sensitive to this about our equality when we're sharing and discussing healthcare. We know that it's not always equal. Okay, we know our vulnerable populations are more susceptible to chronic illness due to lack of going to the doctors and things like that. So advocacy and social justice goes kind of along with our organizations that work to help us with public health. We take a look at our home visits. We're going to spend a lot of time on home visits. Now, what I want you to know about this is what are some advantages to going in the home and what are some disadvantages?
You can see the way the person lives, and then the disadvantages might be like the area that they live in.
Okay, and some disadvantages of a nurse going into a home, there may be a lack of trust there, right, on behalf of the patient. So think about that. We know our assessments are going to be interactive. As much as we're assessing them, they're assessing us. So be careful with that. Not too much disclosure. You don't give too much information right off the bat, because that may scare people away and slow the time down and take time to build the trust. So we're going to remember to establish and assess the environment and what do they have available. That's where we're going to do our ADPI, right? We're going to assess, diagnose, plan, implement, and evaluate. We take a look at our safety as nurses going into a home. Big thing you want to make sure you do, go during the day, dress appropriately, have somebody walk you out to the car, you know, take a coworker, neighborhood volunteer, make sure you're sitting by the exit and check in with the agency at the end of the day, okay? You don't need to let them know that you've gotten there, but you do want to have a schedule for them at your office so they know who's coming and who's not. Any questions on home visits? No. You guys are so quiet. You must be bored. All right. So family, when we look at our families, we're going to understand that we know family has changed over time. No right model. Each family is unique, made up of whatever that patient thinks it is their family. May be bloodborne, may not be. So remember, we have our characteristics of healthy and unhealthy. I showed my class this chart in your book, and I put it on a PowerPoint for us to look at. How do we prioritize our interventions based on our characteristics? So we want them to communicate well and listen, support all members, teach a sense of respect and sense of trust, play together, interact with each other, notice that there's a balance among our members, shares leisure time together, has traditions and rituals, honors privacy of each other, and open boundaries to admit and seek help when they are having a problem. Remember, in our Healthy People 2030, what we're helping to do with parents is we are increasing the proportion of parents who use positive parenting. Which takes us to the acts that help with our public health. So with the Family and Medical Leave Act, we know that was passed in '93, and that does exactly what it says. It protects your job if you need to take care of yourself or others. And so it'll be oftentimes unpaid. Some companies will supplement, but that is not what we focus on. It's usually unpaid, and they're struggling to make a balance work between working and caring for family members. We have our American Disabilities Act, which was in 1990, and that's protection against our disabled Americans. And then we have QSEN, and I want you guys to be very clear on QSEN. It is our quality and safety education for nurses. It is not a moderately, federally moderated organization, whereas FEMLA and American Disabilities Act is going to be. What does it do for us as nurses? It looks at our quality improvement. We work with evidence-based practice and computer and IT. We do patient-centered care and our safety. Which brings us back again, and this is the second time I'm emphasizing this, but the primary goal of our public health is going to be the prevention of disease and disability. So we're going to try to promote independence. We have a population-focused practice. We're going to work to understand the problems such as gender, age. Public health policies are going to create standards. We're going to see our leading cause of mortality again is our chronic diseases, and our increase in the number of adults, we talked about that already, is going to have a increased challenge for our public health. The population of the world is increasing again due to fertility rates and decreased mortality, living longer, having more kids, those kind of things. We see in our health disparities where the biggest impact is on our economics. Our lower income families are going to have higher chronic diseases and less follow-up, as is our vulnerable population. So remember that this is going to be a big one on our health disparities. It's going to be economics, okay? We take a look at evidence-based practice. We know it's using best evidence to make decisions about individual care and our nursing practice, use of clinical trials. The highest we're going to see is our systemic reviews, where there's a bunch of people getting together and they all agree about the same thing. It represents a cultural change in practice, providing an environment that really improves nursing practice and patient outcomes. Remember, we're a lot of customer service right now with nursing practice. We're going to see some hesitation with evidence-based practice when it's put into effect, because of sometimes we're using new technology and our nurses who have been there for 20 years don't want to change the computer systems, right? So we're going to make sure that our evidence-based practice is going to include research, knowledge, clinical knowledge, and expert opinions, okay? We have numerous legal places that are going to influence our practice. A person needs to understand the ethics behind that before they become a member of the profession. So as nurses, we will spend some time doing ethics, but remember, this is going to come up again and again with evidence-based practice. We really have to use our ethical decision-making where we're going to put something into change. We take a look at Healthy People 2030. What's its purpose? It's to change and increase our health equality and social determinants of health, set national goals. Some of those goals are going to have healthier lives that are free of disease, disability, lower or get away from our health disparities. Remember our low income and our vulnerable population. We're going to create healthy social and economic environments. Oops, I had a spelling error there. Healthy behaviors, and we're going to encourage our leaders to be involved in our policies. When we look at our school nursing and Healthy People 2030, what are we trying to do here? We're trying to get those kids with chronic illness to come to school. We want to make sure that we're getting nurses in every building with secondary schools. We're going to get preventative mental health into the schools. We're going to promote health and safety. And reduce our population that has those major violent incidences. Oops. We took a look at school nursing. You guys, we talked about this last week in my class. We're going to try to get with those kids, obesity is a major concern for public health nurse. So we're going to make sure that we're working with that with our teens. We're going to be doing our vaping and our nicotine and things like that. We're going to try to reduce those risks that they get. We're going to injury prevention. We're going to treat emergent care when that happens, right? So we take a look at our kids, and when we're looking at them, we say that what is going to be more important? What's going to take priority over everything in a school building? What's going to be most important? A kid with a skinned knee, a kid who was abused last evening, a kid who's having difficulty breathing, or a kid who doesn't like school. What's going to be our most important?
Good breathing.
Yep. We're going to worry about our airway, breathing, and circulation is always our priority as a nurse, regardless, right? We know that. So please remember that. When we look at conjunctivitis, you'll get pink eye a lot in schools. So what you want to do, hand washing, warm compresses to our areas. And we look at preventing violence so that we engage our parents. The more we engage the families, the less that we see violence in the school setting. So we're going to help with problem solving. We're going to zero tolerance for weapons. We're going to try to keep our schools as safe as possible, right? Any questions on school nursing or those kind of care, the care of kids? You can see here how we're using our med surg and our pediatrics and our OB all here in community. And that's what you're going to see. It's an overlap of that. Okay. When we're looking at our families and doing those assessments, remember, we have those two things that we look at. We have our genograms and our ecomaps. Our genograms are going to be the ones where we look at every member in the family. What kind of conditions do they have? Who's susceptible to what genetic components? The way to remember that is it has the word geno in it, just like gene. And then we have our ecomaps, which starts with an E, and that's going to be your environmental stuff. So like neighbors, social work, churches, schools, clubs, those kind of things. So an ecomap is really going to look a little bit different. It's going to look like, you know, just stems coming off of the main person, because it's all who their environment is, right? And with our genomap here at the bottom, you're going to have distinct, this one married this one, they had 2 kids, this kid had this, that kid had that. What happens if you have a family member with unknown cause of death? Is that going to be a concern? Thank you, April. You're at least alive. So what we know is that is something we're going to follow up on, because we don't know the cause. You know, sometimes knowing the cause is good, but not knowing the cause is not so good. Okay. Any questions on our genograms and our ecomaps? It's going to be a question. This will be a question somewhere around like, what does a genogram represent, kind of? Okay. So we're going to know on that one.
Okay, I just have just a small question.
Yeah.
I heard one of the other reviews. I don't know if I heard it in the review or if it was just in like a Kahoot, But she asked what line would be between like a person that's married. Are you gonna ask something like that? Like
No.
a straight vertical line? Oh, okay. Or a straight.
No, that was in the code.
Okay. I was like,
Yeah.
is that gonna be on there? Because that's kind of
No,
a weird
it's going to
question.
be something general, you know, along the lines of, I don't think, I have to think of every test question, but I've never seen on our test one with a line. I think that was just kind of,
Okay.
but if they're married, it's going to be a straight line. Does that make sense? Because they're
Yeah,
together.
yeah.
So that would be the only kind of question they would ask you. Trust me on that one. You know, men are going to be a certain shape and women will be, I'm going to try to enlarge this for you guys if I can. Oops. Let me enlarge this so you can see here on here. All right, so like you can see on here, like these two are married, they have a straight line. They're together. And so like dad or males are always going to be our squares and females will be our circles. But you're not going to be asked that, April. I'm just, oh, by the way, information. Okay, so don't worry about that. We look at our vulnerable populations. We know. Gosh, my spelling is terrible in this PowerPoint. I am so sorry. All right, we know that our vulnerable populations, subgroup of population, more likely to have health problems. Why? Because of their environment, their social hazards, their personal behavior, and their genetic makeup. So we see that they may have compromised immune systems. We do know things like homelessness does sometimes parallel with mental illness. So you're going to see that kind of relationship, and that's where they're coming from. So it's where they're living, it's who they're around, it's their personal behaviors, and then it's going to be their genetic makeup, like we know impacts everybody and their overall health. When we look at our health, oh, this is so small. So sorry. Try to zoom in. Okay. When we look at our health disparities, we know that largest impact is economics again. We have 7 factors that are going to work with our health disparities. Our first one is going to be income, like we talked about. Income is going to be your number one. You're going to see low income, poor health outcome. We have education. Low education is going to be another problem because we have, if you're not educated, don't know to have that healthcare, you're not going to have that as much. We have our physical environments, like we talked about. So our water, our air, our workplaces, communities, roads, employment. We'll talk about rural health that in the next couple of weeks, and that goes back to our physical, really. Our social networks, who are we friends with? Who are we hanging around with? That's going to make a huge difference here. Genetics, we know, is always going to play a factor on our health disparities. And we see that men and women are going to have very different health concerns when compared to one another. Okay. And our health services, is there doctors available? Are they 6 hours from a hospital? You know, all those kind of things. So that's really going to be our social determinants of health when we look at vulnerable populations. All right, and we are going to conclude the review. Oh, let me shrink that a little bit. All right, we're going to conclude the review just with a little bit about our vulnerable populations again. We know why. They're going to be our homeless, mentally ill, substance users, veterans, and migrant workers. You want to think about those migrant workers, they work in those fields with the pesticides, going to be environmental, right? Poverty is going to be our primary cause of vulnerability. Stress factors of poverty, unemployment, poor education, all that is going to see where we have that problem. So when we're doing prevention for our vulnerable populations, I put a picture here. When I did this picture, I just was fascinated how much hair this guy had in his arm, but that's just a side effect. Anyway, so think about when you're looking at your screenings, you're going to do your support groups, like a therapy group for our mentally ill, for that group. Secondary, we're going to do screenings. What kind of screenings are we going to do? We're going to do those TB screenings, right? In places like prisons, migrant camps, and substance abuse treatment facilities, because we know that these are going to be our higher risks for communicable diseases. So screening on our TB. For our homeless, what we can do to help them out is we can give them a card and say, mail the card in so that they have the follow through there. And that's just one of our examples here. So we focus on poverty reduction, improving education, make sure we're setting reasonable goals. We're going to make sure we tie in tight with the family if that's possible, because they'll be their support systems. And the last little part is about family crisis. So I want you to know on our family crisis, it's when somebody says, I just can't do this. Something happened in the family and they just become disorganized, dysfunctional, and the demands of the situation are just going to be too much for them. So they're going to say, I can't do it. And that's where we're looking at with a family crisis. And then again, I emphasized our genomes and our ecomaps here with and what they do, right? Our genetic and our environment. Oops. We took some time about home visits. Making sure that we don't disclose too much information. Review what we're doing, review why we're doing it, the purpose of the visit. Try to have the whole family there, because being in a home, you're going to see more than you would see anywhere else. And one last thing we take a look at is our ethics and law, which is we spoke about a little bit, but make sure we have to understand our ethics and the moral dilemmas that come with our nursing practice. Our Nurse Practice Acts is what is going to dominate what we can do from state to state. And the example I gave in my class was like for fetal monitoring in like New Jersey, you can't do fetal scalps, but in other states you can. Nurses are allowed to put on the electronic fetal monitors on the baby scalps, but on the East or some places, New York and New Jersey are not allowed. So just some things to think about as we go from state to state. Our rules and regulations are going to be very different. All right, so I covered all that I wanted you guys to know on the study guide. This is the time though, I want you to ask me several questions, ask whatever you want to know. And we'll go through that. Make sure you put your name and your professor in the chat. I'm going to copy that. What kind of questions do we have out there? Nothing. Silence again. What can we think? What do we think about the Kahoot I used in my class, so I'm not gonna do the Kahoot with you guys because you guys have already done it. What else can I go over? One new message. Oops. Okay. Nothing.
Can we have that PowerPoint that you have as well?
No,
Is it
so I
possible?
shared that at the beginning. We are not allowed to share the PowerPoint. That is not, it's, we don't have it published and we cannot share the PowerPoint. If you want to go over the PowerPoint again, rewatch the review. That's our rule of thumb. But that was a good question. Any areas that you are not familiar with that you want to go over?
Professor, can you go over Medicare and Medicaid one more time, please?
Sure. So we're going to know our Medicaid and our Medicare are different. Our CAID is going to aid the people that need it. So I'll pull up the slide, but I will go over it with you too. So you want to know that Medicaid is going to help our 65 and older. And we know that, I'm sorry, Medicare has the word care in it. It's going to help our 65 and older, our baby boomers, and our Medicaid is going to give aid. And it's going to help those with our lower level incomes and disabled. So when you think about it, you think who really needs that aid is those that can't afford or, you know, are not able to work. And our baby boomers are 65 and older, and we're giving them care. It's the best way to remember it.
And they're both healthcare, correct? Like,
They're like insurances.
okay.
Their type of insurance that is federally regulated and with Medicare, and state regulated with both, as well as Medicaid. And the way that you can remember Medicaid like that is because it's different in every state. It's called something different. So the states have a regulation in there. So when we're looking at our evidence-based practice, let's remember our highest level is going to be those studies that more than one person has done, right? We're not gonna just have a basic one study and say that's our best evidence. The higher up it goes in that pyramid that I showed you is the higher you're gonna get with evidence-based practice. So you're gonna need to know, there will be select all that apply on this. And so it will tell you in the question if it's select all that apply. Remember, with our young kids, we're worried about SIDS, we're worried about abuse, right? We're also, because they're not gonna be able to report it to us, and we may not see it in the same way. What else is out there? Nothing. All right, this is gonna be the fourth review that has been done by professors, and I think it will be the last one. So you guys should have access to the other three. There's one professor that recorded it differently, so I'm still working on how to post that in my class, but I have 3 posts. This will be the 3rd posting for my class. And like I said, listen to the reviews, go over them when you're in the car, when you're bored, all that good stuff, okay? Anything else? You guys are so quiet. Did I bore you to death?
No, this is the 3rd one I've heard, so all my questions were kind of already answered.
Thanks, April. I'm glad that you're attending them. That's the best you can do. Does it seem like an overlap? Do you see an overlap on topics?
Yeah, like only two of you, actually, this is the 4th one, but 2 of you have used those PowerPoints and the other 2 did not. It was kind of different.
Okay. Yeah, the way we teach is different. I watch the reviews just a little piece of them to see how
Yeah.
everyone does it.
One of them was like a lot on test taking strategies, which is fine.
Mhm.
But
Yeah, I like in my reviews, just so you know, for the future, I like to cover content. Because I
Thank
feel like
you.
at this point in your nursing careers as nursing students, test taking is always really important, like on our HESIs and stuff like that. But what I know is this is a ton of information. And so I try to focus you guys because it's a lot of reading and it's a lot of content. So I try to cover content, and that's just how I teach, but everybody teaches different, so.
yeah,
Right.
I think at this point, this is really what we need, is it to be like, what's actually, what we need to know, obviously, and more, but like you're explaining it in more depth than we can understand just by reading it in a book.
Okay, well, I'm glad to hear that. I hope it's helpful. And what I will tell you is I'm available if anybody needs help. Your professors are all available as well, but our goal is to teach you guys and to make you guys successful. So I know it seems like a lot and this is a lot of content, but our goal is to make you guys fabulous nurses, and you've made it this far, so you're almost there. This is the first of 4 exams. Your 4th one will be the HESI. Right. So study, listen to the content, go over your study guides. And that's my best advice to you guys. Make sure it's an easy 10 points. Know your math. Let me just look at the math problems and I'll tell you not what they are, but I'll guide you in your math. So you're going to be doing, I don't know what term you guys use, but it's going to be the med comes this way and I have to give this much, so you're going to have a couple of those maybe. I don't see any conversions for weight on this exam, but there may be. Know that kid weight thing. Kilograms of pounds. There's several also editions of the exam, so it's randomized. So sometimes the math will be, but But I think that's it. If nobody has any questions, what I would suggest you guys, like I said, is study the best you can. You're welcome to contact me at any time. I will send your attendance to your professor so everyone knows who attended. And one bit of advice is listen to every single review, because you're going to hear trends that keep coming up, and there's probably a reason for that. Right? All right, guys, best of luck to you. Make sure you have your test downloaded before you take a test, and you have your 2 forms of, you have your ID and you have your laptop and phone. Good. All right, everybody.
On a blackboard
Thank you.
or a whiteboard.
Yeah, a whiteboard or blackboard, either one. All right, take care, everybody. Best of luck.